Hello everyone, I'm Dr. Jayaram, Specialist Family Medicine with more than 15 years of experience working in NMC Medical Center Rolla, Sharjah. So my area of expertise includes diagnosing diabetes, hypertension, thyroid disorders and communicable and non-communicable diseases diagnosis and prevention aspect from preventive care medicine and also anti-aging medicine, and not only that, regarding the immunization and the vaccination as well. Today we'll be talking about family medicine specialty. Basically, family medicine is a broad specialty which we deal with from the pediatric to the geriatric population, and also we will deal with the preventive care and well as communicable as well as non-communicable diseases, diagnosis, treatment and also management of all these conditions, and we will be the first contact in all your medical needs. Basically, communicable diseases are diseases which can spread from one person to the another. So either it could be from the direct means or through the indirect means. So this is called communicable diseases, and non-communicable diseases it cannot spread from one person to the another. So we call these things as a non-communicable disease. Either it cannot spread either indirectly or directly as well. Examples for the communicable diseases like HIV, tuberculosis and malaria, virals, bacterial infections and also parasites. So these all can be communicable diseases, what we say. And if we are talking about the non-communicable diseases, say for example diabetes, cancer, hypertension, and these are all the common things of non-communicable disease which are quite prevalent, and nowadays the non-communicable diseases is the main disease burden in the country. So the regular health checkup is more important because since we understood about the concept of communicable as well as the non-communicable diseases, so now we need to understand why this is more important in terms of health checkup. Health checkup, by say, it helps in four important things. One is it will help in knowing about the disease, and whether second thing is about the preventive aspect, and third is the management of the condition, and fourth important thing is you have a peace of mind. So once you know about properly, once you screened about your health, so you can able to know whether you have a disease or not. That is the main purpose of doing a health checkup. So based on this, I just classified. So this is two important things you need to remember. One is age-based screening. So health checkup is for the healthy individuals who are not having any diseases. So age-based classification is male as well as the female. So once you know about the male or female, whoever be in the age group from 20 to 30 years of age, without any risk factors, so we will suggest annual or yearly once or twice of doing a health checkup would be ideal. Suppose the person is at the age group of more than 40 to 45 in this particular age group, so better to screen for all the most of the non-communicable diseases which are like diabetes, hypertension, cholesterol and other things. So and second is risk factors. Once you have a risk factors of any of these non-communicable diseases of diabetes or hypertension or anything, you require to get the health checkup more frequently. Maybe it could be 3 months or it could be in the 6 months period. You can talk very well to your family doctor so that he will be the first person to help you in that case. And third is the 45 age group. If you are reaching as a female person, so then you think of mammogram, doing a mammogram, and from females from 21 to 29 years of age group, doing a pap test is more important. From 29 after 30 years of age group, pap test plus human papilloma HPV testing is also important up to the age group of 65. So this is for the female specific. And then for the males, for after age of 55 years of age group, prostate cancers are on higher rise. You can discuss with the family doctor and then take a call on doing a PSA test for detecting the prostate cancer. And then apart from that, you can able to do after the age group of 50 years heart diseases and the age related diseases are quite prevalent. So try to screen your treadmill test or echo. So these are all the important aspect. And apart from that, more than 50 years of age group, try to screen for other diseases. So say for example, you need to know about your cholesterol, diabetes, hypertension, obesity, all these things. If the risk factors are there, which I already told you, 3 months or 6 months screening is more important. And after that, 50 years, knowing about the bone density status. 65 years or above, know your bone density status. And in the geriatric population, know about your the bone density along with the ENT as well as hearing screening as well as eye vision screening is more important, because these are all the age group based screening for all these things. And last but not least, lung cancer is more prevalent. So and this is quite more prevalent. The person who is having more than 30 pack years of smoking for more than 30 years, he has to done a CT chest in order to detect these things. So these are all the things which we need to understand. So if you have any doubts regarding the screening and the health checkup thing, you can very well talk to your family doctor. So he will be helping you with that. The top 5 deadly non-communicable diseases in the world is first is cardiovascular disease. So which is total in 2021 data, total 18 million deaths were happened around the world. Second comes is chronic respiratory diseases. So that is like COPD and other diseases of chronic respiratory, which accounts for the second top. And that caters around 8 to 9 million deaths around the world. And third is we are talking about diabetes. Diabetes is on range. So now it is every year it is the number of people detecting with the diabetes rate is getting increasing each and every year. So that is the third. And fourth, we are talking about other diseases. So these are all the things, and cancers. So the cancer is also on the rise. So now the third and fourth the position is between the cancer as well as in the diabetes. Now these are all the highly prone for most of the people, and these are the prevalent diseases around the world. This is most important question, since we are talking about the health insurance per se. So these are all the diseases which is for the healthy individual, and with the normal population, most of the things we are going to screen this population. So mostly it may not be covered, but there are in our hospitals and other things, we have a very good health packages, affordable health packages are available. So you can very well get the health checkup done after discussing if you have any doubts with your family doctor. Non-communicable diseases prevention is more important because it will improve our country's economy. The low and middle income countries are mostly affected because of this non-communicable diseases. So this non-communicable diseases importance is early detection and also prevention. That is more important, rather than you are having an event like heart disease, stroke and other things and then having a big trouble. It's better to early detect and start your prevention. And not only that, there are other non-communicable diseases which you have to remember, like if you have a poor sleep cycle. These days the poor sleep cycle is playing a major role, which causing a trouble to most of the individuals, and smoking and alcohol consumption. So these are all the you can able to modifiable risk factors. These risk factors can be modified. So once you start by addressing these issues and having a good lifestyle, so then automatically this non-communicable disease burden which is going to rise in next few more years because of our lifestyle changes, these can able to you can able to control to some extent. So this is most important rather than treating the event before itself. Once you're able to prevent that, it will have a very good impact on your healthcare. So vaccinations in adult is a more important thing which everyone should understand, because after the age group of 50 years, the 50 and more, the people has to understand your immunity will go down. So once your immunity is going down, so you need to understand there are two important vaccinations. One is pneumococcal vaccination has to be taken. So always think in mind. So pneumococcal, it can be 2 doses. Pneumococcal conjugate and pneumococcal polysaccharide vaccine is available. So you can take that vaccine. And other than that, you have to think about taking a flu vaccine. So everybody who is in from the age group of so you have to take from 15 years to till the 65 years of age group. Every year you are supposed to take a flu vaccine. So this is more important. So this is annual influenza vaccination, because flu is also important communicable diseases. So the prevention is more important. And third is other vaccination, like which I already told you, the HPV vaccine. So HPV vaccine you can able to take from the young itself. So 21 years you can have a Gardasil. So that's a vaccine is available in the market. You can take that. And along with that, there are other vaccination. There is something called Tdap, tetanus, diphtheria, acellular pertussis. So all this 4 vaccination, the 3 combination, which is called tetanus, diphtheria, acellular pertussis. So which is if you are taking at the after 5 years of age, every 10 years 1 booster is required. So that is for the TD. So tetanus and diphtheria, which is being covered. So these are all the most important vaccination which has to be taken. And always remember, whenever you are going into the risky areas, so high risk countries, when you are traveling to different countries, so based on the specific areas and needs, there is something called meningococcal vaccination is there, and yellow fever vaccination is also there. So these are all the things which is only for when you are traveling to the endemic zones. So then those vaccinations can be given. So today's take home message is health checkup is more important. And if you are able to tell so what is happening in your body, so better to have a health checkup at least, from the age group of 20 to 30, at least check once in a year, so that you will be understanding about your own body health first. And once you know about anything, any problem or disease has been detected, so you can very well talk to your doctor, so that he will be helping you and guiding you with your so that you can able to take a informed decision of what to take, so how you can able to prevent. So now you understand about the disease burden, now you understand about your health checkup. So prevention is always better than cure. So this is what we are trying to stress on, that rather than getting an event, trying to prevent is most important stage. So that is the main purpose of the health checkup. So once you get it done in the initial stages, it's easy to treat. But rather than developing in the later and then trying to treat it, it will be a very difficult fight. So it's always stay healthy and stay happy always. I hope I have answered all your queries of family medicine specialty, and also regarding the health checkup, prevention and the vaccination. If you have any queries or you want to consult with me, I am Dr. Jayaram Subramaniyan, specialist family medicine, working in NMC Medical Center, Rolla, Sharjah.